Hello everyone, welcome to Physio Gainer channel. In this channel, we are dealing with the physio topic. So, as you all know that we are continuing with the assessment portion only. We are done with the pain history in the before video. If you have not seen, go and see all the backdate, all the topics are done there only. Now we'll continue. Today's topic is the past history. नाउ एज यू ऑल नो व्हाट्स द इम्पोर्टेंस ऑफ पास्ट हिस्ट्री हिस्ट्री मीन्स एक तरह की हिस्ट्री लेना किसी चीज़ की तो पास्ट मतलब जो चीज़ हो चुका हो उसकी 20 साल पहले 25 साल पहले मे बी इन्वॉल्व बट इट शुड बी रिलेटेड टू द प्रेजेंट हिस्ट्री टू relevant previous medical problem to present condition, maybe cancer, maybe the tumor, or maybe any kind of surgery or any kind of medical condition. So for example, diabetes, hypertension, if the patient is suffering from, and the medication the patient has taken, due to that the patient is suffering today's condition, maybe that is due to overuse of the drugs, there is weakness of the due to that particular condition, there is a weakness in the muscle, or the patient is suffering from the pain in the bone. Whatever the past history is, it should be relevant to the present condition. Okay, like history of the other disease and injuries, example fractures or any kind of fungal disease, or it can be, as I explained before also, for example, patient ne bola today, the patient came and he said that I am having a pain in the low back area, and I asked, is that same pain occur any time before? If same type of pain patient has suffered in the past also, the same thing will ask. तो patient ने बताया या 25 साल पहले, maybe the patient is female, the patient 25 साल पहले I was having a labor pain and I had cesarean baby delivery. So what happened, the patient is going through an anesthesia process, and due to that only maybe the pain only is the hampering the patient's present scenario. Or the patient another patient is also alveoli, and he or she is having a pain, will ask whether he is or she is having any kind of pain or the same pain occur in past also anytime. The patient says, yes, I was suffering as I had fallen from a roof, or I just slipped from the stairs, or I fallen in the toilet, or like that, or any kind of, and that time only the same pain originate, and after that I have taken medication and it was okay, but again it get back as I travel a lot yesterday, and it provoked the same pain at the same site. So it means the patient is having a past history. The same condition occur in the past, and again after a year or after a period of time the patient is having the same pain, it means the patient is having a past history. Okay, as I also explained, the operation, hospitalization is also important, and the medication too, as I explained before also. So this all comes under the past history. Now we'll talk about the medical history. Why the medical history is important? Because maybe the present scenario or in the past the medical history the patient is suffering from, and due to that kind of condition the patient is having today's condition. Patient is having any kind of tuberculosis, hypertension, diabetic, or any kind of prolonged chronic disease. So all this type of जो भी conditions होंगे, जो भी patient को बीमारियां रही होंगी past में, उसकी वजह से भी आज present में उसको ऐसी conditions हो सकती है, like कमर में दर्द हो सकता है, छाती में पेन हो सकता है, या फिर जो भी प्रेजेंट सिनेरियो की कंप्लेन द पेशेंट इज हैविंग, मे बी इट कैन बी रिलेटेड टू दैट पर्टिकुलर कंडीशन. इतने दिनों इतने सालों से ये कंडीशन थी, इस वजह से इनका जो है काइफोटिक पोस्चर हो गया, इसकी वजह से इनको पेन होना शुरू हो गया. ये हाइपरटेंशन था, इस वजह से इनको जो है माइग्रेन शुरू हो गया है. ऐसे से हम कोरिलेट कर सकते हैं, तो इसलिए मेडिकल हिस्ट्री इज ऑल्सो इम्पॉर्टेंट. What about the surgical history? Why the surgical history is important? It is important. It plays an important role. How? As I said before also about the cesarean delivery of the baby, that is also a kind of surgical history, and that's the reason patient is having the pain today. Pain the patient is having. Second is the fracture is also comes under surgery. Any kind of gallstone removed हुआ, या फिर any amputations हुई है, या फिर any surgeries हुई है viscera's में, और anywhere the if there is any kind of surgeries, तो उसमें क्या होता है, removal of anything occur or opening of anything occur, if there is a cut section, anything a kind of surgeries occur, वो कहीं ना कहीं हमारी आज की ज़िंदगी में, आज की कंडीशन में अगर वो हैम्पर करी, इट मीन्स देयर इज़ समथिंग रिलेटेड। तो इसलिए हम जो है सर्जिकल हिस्ट्री पूछते हैं, क्योंकि कहीं ना कहीं जो सर्जरीज पहले हो चुकी है उसकी वजह से आज उनको ये दर्द हो सकता है। तो विल नॉट गो एनीवेयर एल्स, हमने उस चीज़ को ठीक करना है, समझ रहे हैं। इसलिए मेडिकल हिस्ट्री भी हम इसलिए बोलते हैं मेडिकल हिस्ट्री, इसलिए ताकि अगर ये चीज़ है तो इसकी जगह पे हम कुछ और सोल्यूशन निकालें, ना कि हम कहीं और ट्रीटमेंट जाएं, बल्कि मे बी अगर इसकी वजह से होगा तो हम इस चीज़ को ठीक करेंगे, ना कि जो आज की कंडीशन है उसको ठीक करेंगे। ठीक है, अगर इसकी वजह से ये चीज़ हो चुका है, ये अब नहीं है, इनको कंट्रोल हो गया, तो ये हो चुका है इनको, तो ये ठीक करेंगे। अगर बाई चांस इसकी वजह से ही हो रहा है तो हमने गो विद द ऑरिजिन को ठीक करना ज़रूरी है, rather than गोइंग विद द प्रेजेंट वॉट एवर द पेशेंट इज हैविंग लाइक लो बैक एक, विल गो विद द ट्रीटमेंट, नो, गो विद द ऑरिजिन, व्हाट द एक्यूरेट कंडीशन, व्हाट इज द एक्यूरेट कॉज फॉर दैट, विल ट्रीट दैट कॉज। ओके, now the drug history, it's not the last but it is the least. Like drug history is also important because the prolonged taking of any kind of medication, any kind of drugs also lead to certain kind of conditions which the patient may complain that the patient is suffering from. होप आपको ये समझ में आ गया होगा। इफ एनी डाउट प्लीज लेट मी नो। होप आपको ये समझ में आ गया होगा। इफ सो प्लीज डू लाइक शेयर एंड सब्सक्राइब टू माई चैनल एंड कीप सपोर्टिंग मी। थैंक यू सो मच।